Hello, everyone, and thank you for joining us for this Ask the Expert series, one of the series on vaccination. My name is Lisa Bailey, and I will be your host today. Now, Vaccination Week in the Americas began in 2003 as part of the response to an endemic outbreak of measles in the Americas, which took place between Venezuela and Colombia in 2002. So this week, the region of the Americas is celebrating the 19th anniversary of Vaccination Week in the Americas under the slogan, "Vaccines bring us closer, get vax." Now, that just sounds perfect for the times that we're living in right now. We all want to get closer again. Now, this coordinated international initiative has become a key driver of progress in immunization in the Americas and has given countries in the Americas a yearly opportunity to highlight the essential work of national immunization programs. And vaccination is a hot topic right now. The introduction of COVID-19 vaccines has put immunization programs at the center of the pandemic response, with attention turned to COVID-19 and, of course, other routine immunizations. So today we have two experts to talk to you. We have Dr. Karen Broom. She's Advisor Immunization for the Caribbean Subregion. And we also have Dr. Lucia de Oliveira, Regional Advisor in Immunization. Welcome aboard, ladies. Thank you for joining us for this time to talk about Vaccination Week in the Americas. Now, we're in a different time. I was trying to remember what was happening around this time for Vaccination Week of the Americas. It was a different time. How important is this discussion around immunization now? Looking back from then to now, whoever can go first.
All right, so I will go first, and thank you so much, Lisa. And it's a pleasure to be here. Vaccination Week in the Americas is a major event in terms of the immunization calendar, in terms of PAHO and the countries, and its importance has been clear throughout the years. As you know, the Caribbean has been a flagship, a leader in immunization throughout the years, and we have met many goals and have succeeded in reducing morbidity and mortality in children due to vaccination. And it is so poignant at this time that during the pandemic, we have come back around to what has worked for us, what has worked for many years to decrease the illness in our children. And now we're using the same strategy to really to include it in our arsenal against COVID-19 disease. So it's a pleasure for me to be here, and I look forward to our discussions.
Good afternoon, everyone. Thank you, Lisa, so much for the invitation. It's really a pleasure to be here, and also because it's another moment to celebrate the 19th Vaccination Week in the Americas. As my colleague Karen said, it's an important event, and we have been for many, many years, 19 years now, working on the Vaccination Week in the Americas. And also, it's important to highlight that our region was the first one with the Vaccination Week, but now we have the Vaccination Week in the world too, which is a little younger than ours. It's just 10 years, but it's very nice to know that our region was the lead in terms of this Vaccination Week in the Americas, and now we have for more than 10 years around the world. As Karen said it very well, it's a moment that the vaccination is in the agenda of everyone, and the political agenda and the public agenda, and everyone is talking about vaccines and how to reduce mortality and morbidity due to the vaccines, which everyone knows is considered one of the most effective measures in terms of public health. So thank you again, and I'm looking forward to discussing with everyone about vaccines and vaccination.
Okay, we're going to take a break here because I think we have a little technical issue where we are not getting an English audience. So we're going to pause for a minute here, and we're going to switch in the back end to our PAHO Caribbean page. So just give us 2 seconds and we'll be switching over to that page. We'll continue. Okay. Okay, so in case you're just joining us, this is Ask the Expert Vaccination. And if you're just joining us, we have Dr. Karen Broom. She's Advisor Immunization for the Caribbean Subregion. And we also have Dr. Lucia de Oliveira. She is Regional Advisor in Immunization. And we were just talking about how important it is for us to be talking about vaccinations at this time, not only our general immunization, but also as we have moved now into immunization for COVID-19. Has where we are right now in terms of COVID, maybe we can go to Dr. Karen Broom. Has it impacted on the regular immunization campaign? I know you can speak to the Caribbean region, and maybe Dr. Lucia can speak to otherwise.
Yes, Lisa, thank you so much for that question, because definitely we have seen impacts on the immunization program, as all of the Caribbean countries have seen impacts on all of the primary care programs and also secondary and tertiary care. The impacts were seen from last year when we had the lockdown, and therefore access to services was a challenge. Either the health centers weren't open, or they weren't vaccinating, they were only accessible for emergencies, or in terms of transportation. So persons being able to actually go to the health centers was a concern. And then there was anxiety. There was anxiety about COVID-19 disease, and should I leave home? Should I go to the health center? So therefore, we did see a reduction in the number of vaccinations that were being administered. But I am so happy to say that countries quickly recognized this challenge. And after the lockdowns were finished, and we came gradually back to our routine services and offering vaccinations again, countries then implemented strategies to increase and to find and to identify those children and those adolescents that we did not vaccinate. And we used several strategies. We called patients, we put out radio adverts. So the countries really used a lot of strategies to try and find these children, adolescents, and adults that had not been vaccinated in order to catch up. And we are still attempting to catch up now, because as you can imagine, some countries would have seen waves, first, second, third wave. So each time you have to then go back again and help to catch up those children that we would have missed.
Well, I just want to add some points. What Karen just said, in the whole region, we had a very important impact, a negative impact in immunization due to COVID. Also because, for example, in the case of HPV vaccines, usually the strategy of HPV vaccination is through the schools. And last year and this year also in many countries, the schools are closed. So we are losing the opportunity to go to the schools and vaccinate the adolescents. And also campaigns like measles campaigns that were planned last year in 7 countries in our region. These campaigns were postponed because we couldn't do this kind of activity due to all the things that you know, to be close to the people, the lines in the campaigns, everything. We couldn't do that. But as Karen mentioned, I think it's important to highlight that the countries this year, when the things are more a little better, I would say, in terms of how to handle the situation, not the situation, but how to handle the situation. Countries are trying to find new strategies to recover these children and adolescents that weren't vaccinated last year.
It's strange. It's almost like COVID has made it more challenging, but it's also helped in terms of spreading the message that vaccines help us to lead healthier lives. Do we feel as though this is an opportunity to show again the strength of vaccine?
Most definitely. At every turn, it is important that we reinforce the importance of vaccination, the benefits, and that we promote to all of the public, whether that be parents, whether that be the children themselves, the importance of vaccination. And I think what we have been stressing as well is that, yes, we're in the middle of a COVID-19 pandemic, but the other diseases have not disappeared. We still have measles, we still have diphtheria, HPV is still there. So therefore, we must continue our routine campaigns. We are dealing with a COVID-19 pandemic. We don't want an outbreak of another vaccine preventable disease. So definitely within this context, we have been stressing how important it is that our routine immunizations are not forgotten, that they are strengthened, because we did a lot of strengthening. Another positive about COVID-19, yes, we do have some, that we used it to strengthen our immunization programs, our national programs. So then that in turn then helps to strengthen our routine services.
Dr. Oliveira?
Yeah, I think yes, of course. And I think never, ever before we talk about vaccine as now we are talking around the world, right? Everyone now knows what is a vaccine. Everyone knows what is phase 1, phase 2, phase 3 of a clinical trial. So really vaccines is inside of every house right now. And I think we have to take advantage of this discussion that is very hot right now, to use this discussion in this opportunity of give information and exchange information and talk about all the vaccines, not just about the COVID vaccines, but talk about all of these other vaccines that the countries have these vaccines in enough quantity to vaccinate it and prevent mortality and morbidity of all of the disease, like measles, diphtheria, all of the disease in poliomyelitis in our countries.
Okay, as we wait on some questions to come in, I do have a couple that I will continue to ask until we start getting those questions. Do we think in the Caribbean, Karen, that people in general, and I think we'll have some data soon on this from the general public and also healthcare workers, do you think people in general trust vaccines?
I do think in general, persons in the Caribbean trust vaccines. As I've said before, we have a long legacy of high coverage in vaccination in the Caribbean, and we have always been in the forefront of vaccine promotion. So this has enabled us to use this as a platform then in order to launch the vaccine campaigns for COVID-19 vaccine. But most definitely there is great trust in vaccines in the Caribbean, and we continue to keep persons informed every step of the way in each of the processes: vaccine development, vaccine deployment, the vaccine administration, in order that people continue to trust and continue to understand the process, so that there's less anxiety and less doubt.
Yeah. I think we hear a lot about people who don't trust them, but we perhaps don't hear a lot about the people who do. Is that the feeling across the Americas, Dr. de Oliveira?
Well, I would say that in general, in the region of the Americas, especially Latin American and Caribbean countries, people really trust in the vaccines. So far, we don't have a lot of problems with hesitancy. We have the problem for sure, but if you compare with other regions around the world, we are in a better situation. So, but I think this movement has started in our region, so we have to continue informing people about that vaccines save lives, vaccines are safe. This is our main message: vaccines save lives, vaccines are safe.
Now, before, just to remind you, you can ask your questions. They will be fed to us here live and we will ask your questions. That's why we have the experts here for you. It's not just for me to ask all of my questions. Please feel free to jump in and ask your questions as well. Let's maybe just remind, before we turn to COVID-19, let's maybe remind, I know I'm a parent. When things were really crazy last year, I missed lots of appointments because you were so focused on COVID and everything else that was going on. What are some of the routine immunizations that people need to remember, especially for children, but then otherwise as well? Karen.
So in the Caribbean, we have what we call our primary vaccines. And these are vaccines that are usually administered before 1 year of age. Most of the Caribbean countries will administer pentavalent, which is just a name for 5 vaccines that go together, which is polio, diphtheria, pertussis, tetanus, and what's help me, Lucia? Polio, diphtheria, tetanus,
diphtheria,
tetanus. What's the other?
Pertussis.
Pertussis. All right. So those are part of the primary, and then we also have we have the 2 forms of polio, which is the oral polio, and then we have the polio that is injectable. We have the pneumococcal vaccine as well, and that is given in most of the countries before 1 year of age. So when the children then get to 1 year of age, we are looking at MMR, and MMR deals with measles, mumps, and rubella. Some countries also give chickenpox at 1 year of age as well. And remember that MMR is 2 doses. All right. So 2 doses, usually countries give 1 dose at 12 months and another dose at 18 months. But it all depends on your country and your schedule. So it is always advisable, if parents feel that they have missed a vaccine, please reach out to your clinic, reach out to your healthcare provider, ask a question, carry your child's green card and say, here, this is my green card. I'm not sure if he or she has missed anything. Could you please check for me? And I know that nurses are regularly reaching out, especially at this time, reaching out to persons who have missed their vaccination. So you may get a call from your local clinic, you may get a call from your local doctor about your vaccination, but don't wait. Ask a question, carry the green card, see what's missing, and the healthcare provider, the nurse, the clinic, they will advise on what you should do.
So I have someone messaging me who's watching us here in the Caribbean, and they're like, but do we need to focus on those? We're not traveling, do we need to focus on those still, Lucia? Or can we just take it easy on those? That's the question.
No way. You have to vaccine. We have a very a good situation in terms of all of these vaccine preventable disease in the region of the Americas right now, because we have good coverage of the vaccine for many, many, many years. When we started to decrease the coverage, we are going to start to see the disease again. So this is a point that now we are really worried about, because we have seen in the last 10 years that the region of the Americas, which is the lead around the world in terms of vaccination, has decreased a little bit in terms of coverage in all of the vaccines. And so we are doing a very hard work with the countries, governments, organizations, in order to recover this high coverage and keep this disease controlled, eliminated, and eradicated. We have today in our region, poliomyelitis is eradicated, measles and rubella eliminated, and many other the disease that Karen mentioned, the vaccines are controlled. So we have to continue working forever in terms of the vaccine, because if you are going to stay in this situation of elimination or control if we keep vaccinating. If you stop vaccinating, you are going to have the disease again.
Yes. And I also wanted to add, Lisa, if you'll allow me, I remember the 2 I forgot. One was the Haemophilus and the other one was the Hep B. The public health nurses that trained me would give me lashes. So I had to add those in. But I also want to say to that parent that asked the question, we, as much as we would like, we don't live in a bubble. We don't live in a bubble. We interact with persons in our country, and persons come in and out of our countries every day. And they bring everything with them. They don't only bring clothes and food, and they bring disease as well. And we know this. So therefore, we must continue to protect ourselves, protect our children, and protect our communities by ensuring that we have the routine vaccination.
I just want to add another vaccine for children that we didn't mention, Rotavirus Vaccine, which is a very important vaccine which prevents diarrhea and is included in the majority of the schedules in the region.
Yeah, and
the other one given at birth is the BCG.
Right. I think the message is, because everybody's so caught up now, right? You're working from home. A lot of people, you're so caught up with COVID and what's going on. You may have just forgotten. Check your card, check with your doctor or your public health practitioners, just to find out where you are and what you need to get done. Because I know I have 2 children and I am a little, what year is it? What have I missed? So you need to check back. We do have some people asking a question here about COVID-19. So we are going to turn to COVID-19 now. If I had COVID-19, the question says, and have recovered, do I still need to get vaccinated with a COVID-19?
Yes, for sure. Everyone has to get the vaccine when the vaccine is available in your country, in your group of age. You have to get the vaccine. So it doesn't matter if you had the disease before, because we have to get the vaccine. So this is a recommendation from PAHO, a recommendation from WHO, and please, if you had the disease and the vaccine is available in your country, get the vaccine.
And if it is a 2-dose vaccine, is 1 dose enough? You can continue.
No at all. For every vaccine, not just COVID vaccine, if the schedule is 2 doses, you have to get the 2 doses to be fully immunized. If there are 3 doses, you have to get the 3 doses to be fully immunized. In the case of COVID vaccine, the majority of the vaccines are 2 doses, and we have just 1 vaccine at this moment, which 1 dose, but the majority of them are 2 doses, and you have to respect the interval between 1 dose and another dose and take both doses of the vaccine.
And I'm glad that you said that this relates not only to COVID-19, because there are other vaccines, a lot of them actually, that you require a booster dose or a second dose, whatever you call it. Karen, a question for you. If you get COVID-19, can I get COVID-19 if I've been vaccinated? That's a bit of a tough question, but you can try to answer it.
Yes, most definitely you can get COVID-19 after being vaccinated. And this is a very common question. And we have to understand that the COVID-19 vaccinations at this time are not 100%. So 1, you can get COVID-19 if you have not completed the series. So if you've only gotten your first vaccination, you have not completed and gotten your second, yes, you can get COVID-19 after that first dose. All right. And you can also get COVID-19 after the second dose. But what we have found is that this is not common at all. It is not common at all to get COVID-19 after vaccination, but there have been documented cases of people with COVID-19 after vaccination.
The reason why
I'd like to add something.
Go ahead. Sure.
Oh, thank you. As Karen said very well, non-vaccine, including the COVID vaccines, are 100% effectiveness. We always have a margin that the vaccine sometimes is 90, sometimes it's 80, sometimes it's 70. So you can get the vaccine because you can be one of these persons which the vaccine didn't work. So the majority of the people are going to be immunized, but you never know who is the person who is not going to be immunized. So that's why when you have a very high circulation of the virus, as we have right now, after the vaccination, we still have to keep using your mask, keeping social distancing, and washing your hands the same way that you did before, because we still have this virus circulating a lot in all of the countries. We have to wait for a coverage to be very high in countries to be sure that the circulation of the virus decreased. And then you can reevaluate it, how we are going to be our normal life again.
And if I can add as well, Lisa, because I know what's coming next. I know the question is going to be, but if I can still get COVID-19, why then should I be vaccinated? Because that usually is the question. And to persons that ask this, I always say, COVID-19, even after getting COVID-19, after you've been vaccinated, it is usually mild or moderate disease. All right. So the probability of severe disease is much reduced. And we know that this is why we vaccinate. We vaccinate to reduce morbidity, which is sickness, and mortality, which is death. So if we can eliminate the illness, the hospitalizations, and the death, then the vaccine has been very, very successful. So I want to say to you, yes, get vaccinated, because even those uncommon cases where persons were still positive for COVID-19 afterwards, it was mild illness.
And that's why I said it was a tough question, because I know you know the answer to the question, but it leads people to say, but then why take the vaccine? If I still have to wear a mask, if I still can get it, why take the vaccine? So I'm glad that you followed on with that. Can we talk a bit about the side effects of COVID-19 vaccines? And let's start with the mild to what can be considered a little bit more troublesome. Maybe Dr. Oliveira, you can handle this one. What are some of the side effects that we know about in terms of COVID-19 vaccines?
Thank you, Lisa. I think it's important to point it out that every vaccine, every medicine have at some point adverse events. Tylenol that you take could have a side effect. So the vaccines also have some kind of adverse events. What we do in terms of public health is always balance the risk and the benefit. It's much better to take the vaccine and take some very small risk and to be protected from the disease, or should I don't take the vaccine and then I'm gonna be in a high risk to get the disease. So these vaccines, the COVID-19 vaccines in general are very, very safe. And they have been, nowadays we have more than 300 billion doses applied around the world in these 11 vaccines that we have been applying around the world. And well, of course, some adverse events have shown because we are applying millions and billions of doses of vaccine, and they didn't show when the vaccine was in the clinical trial, because the clinical trial vaccinated 20,000, 30,000 people. So rare adverse events, they appear after the vaccine is in the real world. So it's expected. So, but in general, all of these vaccines have a very mild event adverses. Headache, fatigue, some pain on our muscles, and tiredness, this kind of fever, low fever, and it's normal, it's expected. There are some events a little more complicated, but they are very, very, very rare.
And there's a question in terms of someone who is on birth control. If you're taking birth control, can you take the vaccine? Either of you can answer this, whoever knows. Yeah.
Sure.
Right. Yeah. At this point, their birth control is not a contraindication to taking the COVID-19 vaccine. The contraindications are if you've had an allergic event to the first dose, then if it's a 2-dose regime, then no, it's a no to the second dose. And I always advise, and it is always recommended, that if you have any doubts, you check with your general practitioner, you check with your healthcare provider. But the hard and fast contraindication is allergic reaction to the first dose or an allergy to any of the vaccine components.
Remember, I'm always going to ask you to break down those words. Contraindications, Doc.
Contraindications, I'm sorry, it means that this is not for you. That's what that means.
Exactly.
So remember, you can send your questions. Some of you already are sending in your questions. I know, I mean, I thought about this. If I was pregnant at the time, I would probably be so scared. So let's talk to ladies who are either on birth control or those who are either pregnant or breastfeeding, have a baby here. If you're breastfeeding, can you take the vaccine?
Okay. Well, all of these, the vaccines, we have recommendations from the group of experts in immunization from WHO, which is called SAGE. This group of experts has been reviewing all the data about these vaccines and giving recommendations. And that's are the recommendations that PAHO is using for our countries. In terms of breastfeeding and pregnancy, the recommendation is if the pregnant woman or the breastfeeding woman who is breastfeeding is in a group of risk, it means if she is a healthcare worker and she has diabetes, hypertension, or the epidemiological situation, the place that she lives, it's really, really bad, she could take the vaccine. This vaccine, there are many studies right now about this. This group of people wasn't included in the clinical trials, but now we are studying the vaccination in these groups, and the recommendation is depending of the risk that this woman has in terms of to get the disease.
Okay, we're getting lots of questions coming in now. Thank you for joining us for Ask the Expert. Vaccination. Now, this is a typical question. We've heard this before, but I'm going to ask it because we need to answer this. These COVID-19 vaccines were developed so fast, Ms. Gabriella. Why should I trust them? Dr. Broom, take this one.
Thank you, Lisa. And this has been a question that we've been fielding from the very beginning. Yeah. And persons are concerned about this, but I think really when we talk about vaccines being developed quickly, we have to look at the history. We have to look at, this is not the first coronavirus that we would be developing vaccines for. We have to look at SARS. That was when we first started looking at coronavirus and vaccines, and SARS was in, Lucy, help me, was that 2007?
Yeah, around 2007.
Right. And so that was many, many years ago. When we first started looking at developing vaccines for this family of viruses, which is the coronavirus. And then so we've been doing this, we've been looking at this since 2007, which is quite a number of years ago. And then as we came forward and COVID-19 came about, it was about ensuring and facilitating the process of development. So normally when vaccines are developed, you have a specific timeline and you follow the timeline. And with COVID-19, the same steps that we normally do with the other vaccines, we took with COVID-19. But instead of doing one step today or one step tomorrow, one step last year, one step this year, the steps were done, some were done sequentially, meaning one after the other, and some were done at the same time. And this was facilitated by global efforts and support for the vaccine companies. So this is why we were able then to get a vaccine in a shorter space of time than we would have seen in previous years. One, because the technology is already there. We were already looking at it. The technology was there. And two, platforms that we would have used for all the vaccines were already being developed and discussed for this vaccine, for this virus. So this is why we were able to come to this endpoint with this COVID-19 vaccine, and not just one, but several, to be able to administer to the public and try to halt the pandemic.
I just want to add that beside of all of these points, also never and ever in the history of the vaccines, we had a lot of money in all the scientific society around the world just working with one objective, to find a vaccine for COVID-19. So this is an effort, as Karen mentioned, a global effort. Usually for the vaccines, it doesn't happen like this. The other vaccine is like one company, pharmaceutical company, two pharmaceutical companies, but at this time was every company around the world were working and still are working in terms of to find new other vaccines.
This may actually be something that we need to look at in targeting other diseases, this global coming together and working
for sure.
Solidarity and working together to tackle something that's affecting so many people. We have two questions here. One about children. How do we protect our children? Can children get vaccinated against COVID-19? And if no, when will they be able to be vaccinated? Dr. Broom, you want to take that one?
So at this time, there is one vaccine that has been pre-qualified by WHO that you can get from the age of 16. All of the others, the minimum age is 18 years. There are studies involving children, and we are hoping that by the end of the year that we would get some data on these studies, and then going forward look at vaccinating our children.
Yeah.
And Dr. Lucia, how do we protect our children? They can't be vaccinated, but how do we protect them?
Well, with the measures that we have been doing before the vaccine, and you have to continue doing. We have to show to our children that they have to wear masks, keep distancing, and washing hands, and all the measures that you know that are part of the control of the pandemic. I think it's very important to say the vaccine is not the only tool. Vaccine is one of the tools that we have in order to control this pandemic. So we have to do all of these non-pharmaceutical measures in order to control. The vaccine is not going to control the pandemic alone. So the children have to do everything, but they are not going to get the vaccine so far. Maybe, as Karen mentioned, there are a lot of studies going on. Maybe until soon we are going to have some data and you can use the vaccine in children. But when you don't, at this moment, when you don't have the vaccine for children, let's continue with the other measures.
Okay, someone wants to know, Felix wants to know if he can get seriously ill from the vaccine. I think that depends on if you have any underlying conditions, but Lucia, you can talk to Felix. Can I get seriously ill from the vaccine?
Well, as I mentioned before, you are not going to get sick. We can get have some adverse event, which is, as I mentioned before, serious and adverse events are very, 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 very rare, and some mild adverse events you can get, and they are normal. In the clinical trials in phase 3, we see that we saw that, for example, 50% of the people who received the vaccine had headache, a little of fever, a little of, as I mentioned before, muscular pain, fatigue, and still we are seeing that during this phase 4 vaccination in the real world. So yes, you can get this kind of mild disease, which is in general 24 hours. After 24 hours, you are completely normal again and happy because you got the vaccine.
Now, this takes me to a question that was asked of me because, once you work at PAHO, people think everyone is a doctor and you know everything. So if you had the vaccine and you had no effects, you felt nothing, did it work?
I myself have had this question. Person said, but I heard this, that my brother had fever, or my father had a little pain in his arm, but I'm not feeling anything. And I said to them, well, good for you. Good for you. Right? Because everybody's immune system, and when I say immune system, I mean the way that the body reacts to the vaccine, the way that the body fights disease is different. So you're not going to see it the same way in everyone. Some won't feel anything, and others, might get, as Lucia said, pain in the arm, fever, a little chills, but have no fear, the vaccine is working.
Look at this, for example, the data that we saw in the clinical trials, and you are seeing here in during the vaccination. It's around, let me say, some of the adverse events are like fever, for example, is around 50% of the people present fever after the vaccination. If you vaccine 100 people, 50 are going to have fever, and 50 are not going to have fever. You can be one this side or one of the other side. So it's completely normal. And you have to understand that the vaccine is working the same way in my body, that if I have fever, if I don't have fever.
So do we know at this point how long these vaccines will last in terms of the coverage for the COVID-19 vaccines? Dr. Broom, can we say yet how long the coverage lasts, or are we still in a wait and see with this one?
So we are still monitoring. We're still monitoring because, as Lucia said, the time when we administer in the public, this is still time that we monitor and see what happens in the real world. Trial is one thing, but when we start to administer in our population, this is the real world. This is the reality. What are we seeing? So some early data is saying that that there is up to 6 months of protection there, and so we continue to wait and see how long we can go with the antibodies and how long the protection is lasting. So it really, we are waiting to see.
Okay, we're getting lots of questions flowing in. I really want to thank you so much for being a part of this Ask the Expert session. We probably got another 15 minutes or so. Here's a question from Maurice. He says, I eat healthy, I take all natural plant medicine, I rarely get sick. Do I still need to take the vaccine? Lucy.
Yes, Maurice. I'm glad for you that you eat healthy and you take natural plant medicine. This is so good. It really helps your health. But don't forget, today we have more than 3 million deaths around the world due to COVID-19, and we have almost 1 billion cases, most of them very serious cases. And this virus, unfortunately, this virus doesn't have any kind of barrier. Everyone can get this virus, and everyone can be in a situation that the disease is very serious. You need hospitalization, go to UCI, or even death. Of course, we know there are some risk factors that increase your risk to get the vaccine and to get a very serious disease. But we also know that this virus has been changing. For example, at the beginning of the pandemic, older people are the people who had the vaccine. And now we are seeing in many countries that young people and health young people are getting the disease. So please, if you have the opportunity in your country to get the vaccine, go there and take your vaccine.
Yes, Lisa, and I would like to add as well that also is a very common question. I eat well, I exercise, I hardly ever get sick, but I have seen many stories from persons who did the same thing and they became quite ill with COVID. And they said, but they didn't expect it to happen to them because they did all of the right things. They were really healthy. They ran marathons, how, it was a surprise. And I don't want it to be a surprise to anyone. I don't want that. I want you to be aware that, yes, you are vulnerable. If you are exposed to the virus, you can become infected and you can become.
I think what was the deal breaker for me was when it was said very clearly that yes, you can still get COVID, but it is very likely that your symptoms will be a lot less severe. I don't know if it impacted people as much as me, but when you heard about so many people being on ventilators for a long time, and then that whole discussion on long COVID, there are people who feel the effects of COVID for such a long time after. I feel as though once you weigh the risks, to me, the risk of getting COVID was higher than the risk of taking the vaccine. Yeah, so that's how I work through it in my mind. Let's talk a bit about healthcare workers. I don't want you to quote figures because you may not have them to hand, but how are we doing in the different regions where you work in terms of healthcare workers and coverage? Do we know?
Sorry, I didn't coverage of the vaccine or
vaccination and healthcare workers. Are we doing pretty good with vaccination of healthcare workers?
Well, I'm going to tell about the region in general, and then Karen can talk about the Caribbean region. Yeah, the healthcare workers was the first group considered the priority group in vaccination when we started to organize the plans of vaccination plans in the regions, because it was shown that this group was the group with higher risk for the disease, because they were with the patients hours and hours and hours of the day. So they are in very, very high risk. So this group was the group which in a majority of the countries was the first group to be vaccinated. And also we have to admit it is the easier group to vaccine, because you go to the health center or the hospital and you know the people are there and you can vaccinate. So I would say that in terms of general terms, this is the group with nowadays with the higher coverage in general in the countries.
Yes. In the Caribbean, it was very important for us to get that buy-in from the healthcare workers because they're highly respected. You form that relationship with your provider, whether it be private or public, from young as a child, and then you grow up with that nurse, you grow up with that healthcare provider, and their opinion, their advice, their guidance matters. So therefore, it was so important for us to have the healthcare workers get on board and get vaccinated, because then we could then have their recommendation and their respected voice in the communities saying, this is what I did and this is what is best for you. So in terms of the healthcare workers, they were definitely, as Lucia said, one of the first to get vaccinated, and a very, very important group to vaccinate.
I mean, as you said, they're very important in terms of getting the message out there, but we also don't want them to be sick. We don't want to lose our healthcare workers who are there to take care of us if we were to fall ill. Now, I heard someone ask, I can't remember, it was a leader of a country, which vaccine should I get? And the leader said, whatever vaccine is available in your country that is approved. So we do have some queries about specific vaccines. Antonio wants to know your feelings on AstraZeneca. We know there were some questions with it not being accepted by the FDA. Can we trust AstraZeneca or any of the other vaccines? Dr. Lucia, you can take that one.
Okay, thank you, Lisa. Yeah, don't forget in the United States, there are other 3 vaccines that are being applied in the whole population. And AstraZeneca is much more used at this moment in different other countries. Many countries in Europe are using AstraZeneca. Actually, England UK is the first country to start using the AstraZeneca vaccine because the production will start from there. And this is a very good vaccine as all the others. This vaccine has been has the emergency use list from WHO. This vaccine has recommendations from the SAGE, which is this group of experts in immunization from WHO. And this is a very good vaccine, as all the others that have been using in the countries. Answer your question, yes, you can trust in AstraZeneca vaccine.
Now, of course, there's a question about blood clots. Gabriella wants to know about the blood clots concerns. I'm scared to get vaccinated because I've heard so much about blood clots. Dr. Broom, why should I get vaccinated if it's risky?
We spoke a lot about adverse reactions. We spoke a lot about weighing what is more likely to happen. Yes, there's been a lot of talk about blood clots and events with AstraZeneca, and they were exceedingly rare. But it is not exceedingly rare for persons in our communities to get COVID-19. It is not. So you have to weigh what is the most likely scenario for you.
Exactly. I'd like to add something in terms of numbers. Nowadays, you know that we have, in terms of adverse events of the vaccine, we have 4 cases for 1 million of doses. And you know also that there is 36 cases of blood clots per million of people who had COVID disease. Or it means that the risk to have blood clots due to the disease is much higher than due to the vaccine. So again, everything is risk and benefit. If I know that the risk for one thing is higher, not taking the vaccine, I'm going to have the vaccine. We are just going to stop some vaccine or vaccination or program or something like that the day when we don't know, based on evidence and data, that the risk with the vaccine is higher. And it's not the case at all for any of these vaccines that we have right now around the world.
Now, I know that it has been probably very difficult for healthcare workers to manage this process. How are we doing across the region of the Americas? We haven't done an adult vaccine rollout to this magnitude, I think, in years. I certainly don't remember anything like this in my time. How are we doing in terms of our rollout in the Americas, Dr. De Oliveira? And I know it has been a little difficult. Some countries are not getting vaccines as quick as others, but how are we doing in terms of the rollout? No matter how much vaccines you have, the rollout of the vaccines.
Thank you for this question, and I think it's so important question, and it's very. I think we should feel proud to say that our region really knows how to do the rollout of the vaccines. We have a lot of experience in campaigns. We have millions of doses of measles, rubella in campaigns in the past. Our immunization programs in the countries are very well organized, much better organized than many countries in Europe and many countries around the world, because we know how to do a vaccination campaign. Unfortunately, we still have this no equity of distribution and acquisition of the vaccines, and we still have countries with a very small number of doses to distribute in the population. But this is the problem. The problem is not the organization. The organization is doing very, very well.
And I would like to add to that, Lisa, to say hats off to the healthcare workers, because they started last year battling COVID and all of the COVID-19 activities, all of the testing, all of the swabbing, all of the wearing the PPE, making sure taking care of persons with COVID-19. And then that transitioned into getting ready to receive vaccine, doing all of their deployment plans, doing all of what sites are we going to use, where are we going to get those resources from. And I'm going to say that the countries, I am so proud of the countries and the workers. The depth of our national immunization programs came out during COVID-19 vaccination. The depth, the knowledge, the resources all played a role in getting the population to the sites and being vaccinated. And I think it is a tremendous effort that is still continuing. And the healthcare workers really have pulled out all the stops. And I just needed, the opportunity to say hats off to the healthcare workers, and from all of the Caribbean, thank you.
So well said, Karen. I think we're coming up on the hour now, so I think I'm going to let you all have your final words. I wonder where we'll be next year at Vaccination Week of the Americas. What will be the setting then? Hopefully we'll be closer. Hopefully we can have an event where we're in the same space. Last words, Dr. De Oliveira, over you first.
Thank you so much, Lisa. Well, I think I would like to repeat something that I said at the beginning, which I think no one should forget. Vaccines save lives. Vaccines are safe. We have to have it in our minds in order to save many, many, many people, in order to save our children. And I'd like to say too, something that Karen just mentioned, because I think everyone should say that. Thank you for our health workers. They are doing a wonderful, amazing work in the world. And now with the vaccination too. So thank you so much for everyone who is working on this terrible fight that you are having with this virus. Thank you.
Dr. Broom, your final words. You see there are two last questions there, so you can rope that into your final natural medicine and children, your final words.
Okay, so we spoke about the natural medicine falls in the same category as eating well, keeping fit, just living a very healthy lifestyle. It is great. That is what is recommended. But at the end of the day, you are still vulnerable. If you are exposed to coronavirus, to COVID-19, you will, and you become infected, you will become ill. It is, if you look at the risk, if you wait, you see it is always better to take the vaccine. When the vaccine becomes available for children, when the trials are over and we have our data and the vaccines are then approved for children, then we will ensure that children are vaccinated. But for now, we must ensure that the children continue to physical distance, wear their masks, wash their hands, make sure they have that respiratory etiquette. It's a big word. All it means is you sneeze into a tissue, throw it away, and wash your hands. Wash your hands, wash your hands. So my final word is vaccines bring us closer together. Let us make that a reality.
Well done. Thank you so much, ladies. That was a very interesting and engaging conversation. I think it was a good way to be a part of our Vaccine Week of the Americas. I want to thank you so much for all of your questions and for being a part of this Ask the Expert session. And remember that this is the perfect time to focus on vaccinations, not only for COVID-19, but for all of the other diseases that we want to beat back as well. And Vaccination Week of the Americas is a really good illustration of what can happen when countries work together, different languages, to improve their population's health. Thank you so much for joining us today. And remember, you can check out all of our pages, PAHO, WHO, all of our pages for up-to-date and accurate information on COVID-19 and all of the other illnesses that we are working to beat back. Thanks for joining us. I'm Lisa Bailey, and be sure to follow us for another session coming up really soon. Bye-bye for now.
Bye-bye.
Bye-bye.